So good morning, sir. My name is Mary Jo Andilis Canilla, taking up Bachelor of Science in Nursing, second year student, Section A. So in this video, I am going to perform the EINC or the Essential Intrapartum Newborn Care. So in December 2009, the Secretary of the Department of Health, Francisco Duque, signed the Administrative Order 2009-0025, which mandates the implementation of EINC protocol for both private and public hospitals. So the EINC practices are evidence-based standards for safe and quality care of birthing mothers and their newborns within 48 hours of interpartum period and a week of life of the newborn. Now, prior to the transfer of the woman to the delivery room, first is ensure that the mother is in her position of choice while in labor. This is to promote relaxation and comfort. Next is to ask the mother if she wishes to eat, to drink, or to void. So good morning, ma'am. Would you like to eat or drink something? Okay, so how about going to the bathroom? Would you like to go to the bathroom? Okay, ma'am. Thank you. So the next step is to communicate with the mother and inform her progress in labor. This is to give reassurance and encouragement. So ma'am, as of the moment, you're already 10 centimeter dilated. That means we will be expecting some contractions, so be ready, okay? Okay, ma'am. So, assuming that the mother is already in the delivery room preparing for her delivery, we are going to check the temperature of the delivery room area to be 25 to 28 degrees Celsius. This is to eliminate air draft. Next, we are going to ask the woman if she is comfortable with her semi-upright position because proper positioning ensures better visualization. So, ma'am, are you comfortable with your position right now? Okay, ma'am, thank you. So next, we are going to ensure the woman's privacy. Remove all the jewelries, wash your hands thoroughly, observing the WHO 1, 2, 3, 4, 5 procedures to deter the spread of microorganisms. So next is prepare a clean newborn resuscitation area on a firm and flat surface. And check the equipment if clean, functional, and within easy reach. This is to save time and can work systematically. Next is to arrange materials or supplies in a linear sequence. So we have here pair of gloves, and assuming that we have here 2 pairs of linen, 1 bonnet, oxytocin injection, 1 piece of 3cc syringe, plastic cord clamp, instrument clamp or forceps, 1 surgical scissor, and kidney basin. So assuming that this is all my equipments for the procedure. So next, in a separate sequence, for after the first breastfeed, to symbolize physical examination, we have here the, also assuming this is the eye ointment, I have here stethoscope, cotton balls, 3 hypodermic 1 cc syringe, and a vitamin K injection, hepatitis B, and BCG vaccines. So assuming that we already performed the hand washing, next step is we are going to put 2 pairs of gloves aseptically if same worker handles perineum and cord. Next, at the time of the delivery, we are going to encourage the mother to push as desired. This is to provide support system. Okay, ma'am, just keep on breathing. Inhale, exhale, and push. Inhale, exhale, and push. Okay? Okay. Next is drapes clean dry linen over the mother's abdomen or arm in preparation for the drying of the baby. Next is apply perineal support and thus control delivery of the head. Okay, ma'am, just keep on breathing. Inhale, exhale, and push. Inhale, exhale, and push. Next is calls the time of the birth and sex of the baby. So time of delivery, 2:30 p.m. Next is to inform the mother of the outcome. So ma'am, your baby is a healthy female. So next is dries the baby thoroughly from the face, head, and going down to the trunk and extremities while performing a quick check for breathing. So during the first 3 minutes, remove the wet cloth and places baby in skin-to-skin contact on the mother's abdomen and chest. This is to provide warmth to the baby and to provide comfort. It also promotes early mother and child bonding. Next is covers the baby with dry cloth and the baby's head with bonnet. Excludes a second baby by palpating the abdomen in preparation for giving oxytocin. So ma'am, I'm just going to check your abdomen to check if there's it's already clear. So next, we are going to give IM oxytocin within 1 minute of baby's birth to prevent bleeding to the mother. And after wiping the soiled gloves with the wet cloth properly, this is to deter the spread of microorganisms with proper disposal of used clothes. So ma'am, I will be giving you oxytocin to prevent bleeding. So next is to remove first set of gloves after positioning the baby for cord clamping. Decontaminates the gloves in chlorine solution for at least 10 minutes. So next is to palpate umbilical cord to check for pulsations. After pulsation stop, clamp the umbilical cord using the plastic clamp or cord tie to 2 cm from the base. Places the instrument clamp 5 cm from the base and cut near plastic clamp, not midway. So next is to wait for strong uterine contractions, then apply controlled cord traction on the uterus, continuing until placenta was delivered. Next is to inspect the lower vagina. Massage the uterus until it is firm. Next is to inspect the lower vagina and perineum for lacerations and repairs lacerations as necessary. Okay, so it is normal. Next is examine the placenta for completeness and abnormalities. Okay, so the placenta is normal. Next is cleanses the mother, does perineal flushing, and applies perineal pad, napkin, or cloth, and then checks baby's color and breathing. Check the mother if comfortable and the uterus is contracted. So the baby is normal. So next is to dispose the placenta in a leak-proof container or plastic bag. Decontaminates, soak in chlorine solution instrument before cleaning. Decontaminate second pair of gloves before disposal, starting that decontamination lasts for at least 10 minutes. Next is advises the mother to maintain skin-to-skin contact. Baby should be prone on mother's chest in between the breast with head turned to one side. So, ma'am, we are going to maintain the skin-to-skin contact with your baby, okay? Next is advises the mother to observe for feeding cues and cites examples of feeding cues. So, ma'am, if the baby will start to touch your nipples, just feed her, okay? That means she needs to be breastfeed, okay? Okay. So, supports mother, instruct her on positioning and attachment. So, ma'am, I will just elevate you for proper positioning. Okay. Next is waits for full breastfeed to be completed. So, after complete breastfeed, administer eye ointment. Then given the vitamin K, hepatitis B, and the BCG injection. So ma'am, I will be removing this pill, okay? So ma'am, I will be giving an eye ointment to the baby. And vitamin K. So vitamin K will help prevent severe bleeding. So next is the hepatitis B for hepatitis prevention. And next is the BCG injections. This is for TB immunization. Okay, ma'am. Next is to advise optional delayed bathing of the baby. So, ma'am, the baby is not allowed to take a bath since it will cause her a hypothermia. Okay? Okay. So, advise breastfeeding for demand. So ma'am, every time that the baby will touch your nipples, that means it is her feeding cues, meaning you will give her the breast feed, okay? Okay. So check the baby's breathing and color, and check mother's vital signs, and massage uterus every 15 minutes. So ma'am, I will be checking your vital signs. So next is to complete all records. Accurate documentations allows for comparison of data. So observe cleanliness and order in the performance. So that would be all. Thank you.